Welcome back to another episode of Ingrid's World. My name is Ingrid Paris-Hicklin. I am the host and executive producer of the show. On this show, meet Dr. Krishna White, MD, MPH, attending physician at the Craig Dalzheimer Division of Adolescent Medicine at Children's Hospital of Philadelphia and Associate Professor of Pediatrics at the Perelman School of Medicine at the University of Pennsylvania. Dr. White is a board certified in pediatrics, adolescent medicine, and addiction medicine. Currently, Dr. White is the medical director of substance use services and outpatient medical director for the division. Welcome to the show, Dr. White. Well, Dr. White, I'm thrilled to have you on the show talking about a very serious issue. But before we start into that conversation, tell our audience, our viewers, about your background and about yourself.
Sure. So again, thank you so much for having me to talk about this important subject. I'm so excited to be on your show. I'm born and raised in Northern Virginia, grew up in Dale City, Virginia, graduated from Hilton High School, went to Hampton, did medical school in Virginia, and then came up to Philly to do pediatric residency. Came back down to the DC area and did fellowship in adolescent medicine at Children's National in DC. And then I worked for a few years in Delaware, and I've been at the Children's Hospital of Philadelphia for the past almost 4 years, working in their adolescent medicine division and helping to start a substance abuse clinic in our division.
Wow. So let's now talk about your work in medicine. I mean, because you've done some amazing work in medicine.
Yeah, it's been an interesting road. I really always had an interest in kids and teenagers and the problems that teenagers face as they're growing up. And as a part of that work, I started to see patients that were affected by substance use, and they landed up in the hospital, they were seen in clinic, and people weren't really prepared to see them. They were too young to go to the adult specialist, but a lot of times pediatricians weren't comfortable managing these substance use issues that they're used to considering to be more adult issues.
Wow.
And that's what got me interested in the field.
I had never thought about it that way because, yes, it's more lined up with an adult, but a pediatrician would be seeing this. Wow.
Exactly. I think people forget that addiction is a pediatric disease. When you ask people that are in recovery and that are getting treatment for addiction as young adults, when they first started using substances, most of the time they're going to say that they started using when they were teens.
Oh my goodness. Oh my goodness. So tell us about some of the services offered at the Children's Hospital of Philadelphia Adolescent Medicine Division.
Sure. Our adolescent medicine division is one of the largest, if not the largest in the country. And we take care of any type of problems that adolescent medicine, adolescent patients face. So we have some providers that'll work in the primary care clinic and provide primary care for patients. We take care of all reproductive health needs that a young person will need. We have a gender clinic and treat kids with gender dysphoria. I see patients that are affected by substance use. And then we also take care of patients with eating disorders. That's probably our largest population.
Wow. So what is one of the biggest threats impacting our youth?
So unfortunately now we're seeing overdoses impact all ages, but it is impacting our youth and even the younger adolescents and pediatric ages. We're seeing overdoses as a leading cause of death.
Wow. And so you're seeing overdoses. So how has the opioid epidemic impact our youth in such a way?
Sure, the opioid epidemic, as you know, has been going on for decades, and it's gone in phases. Originally started with prescription drugs and moved on to heroin, and now we're seeing the synthetic opioids. So those are the opioids that are made in a lab. Examples like fentanyl and carfentanil, and that has replaced heroin in a lot of the big major cities as the opiate that's sold on the street. And we're not just seeing fentanyl in people that are intentionally buying opioids. We also are seeing it contaminating other products. A kid might try to get a pill to help them sleep or think it's an anxiety medicine or another prescription drug when it's really synthetic opioid and it's leading to overdoses.
So discuss the need for more awareness about the signs of opioid abuse.
Sure. I think that, there's two things that we as pediatricians and parents in the community need to be aware of with youth. In general, if, a youth may have trouble with substance use, if you're noticing changes in behavior, changes in their friends, changes in their grades, changes in their medical health. A lot of times they present to us where we think that they have just the eating disorder and it's because they're abusing substances. So any of those could be signs that they're having a problem. But the other things to be aware of is that you don't have to be addicted to an opioid to die from using an opioid. For some kids, it's just one time. And so they get a pill from a friend or they take something at a party and they don't really know what's in it. And they can overdose. And those are the tragic ones that we're seeing, unfortunately, in the younger youth.
Dr. White, I really appreciate you telling us that, because I think that what you're saying is that you take it once and you can die. Oh my goodness.
Yeah.
Yeah.
And we're seeing it in the teenagers that are taking it, but we're also seeing it in little kids that are finding it in the households. I know when I was home in Virginia a couple weeks ago, there was a story about a 11-month-old that found one of her parents' pills and overdosed. And so it's just one of those things that you have to think about when you find someone and they're not responsive, even if you don't think that they could abuse drugs or they're addicted to drugs, even if it's a baby or an infant, you have to think about, could they have been exposed to opiates and consider given opioid reversal medicine.
Wow. So that's a perfect segue to the next question, is about the treatment and prevention of opioid abuse.
Sure. So one good thing for prevention is a lot of things that we know as a society and we know as parents are good for our children are great for prevention. So knowing where your kids are, having them connected to the community, knowing who their friends are, supervising them, kind of increasing those protective factors that make them less likely to turn to alcohol and drugs for coping or for stress or to become addicted to it. Knowing your family history. If substance abuse runs in the family, if mental health problems run in the family, then your child or yourself may be at higher risk of developing addiction. So those kids, you want to particularly make them aware of that history and kind of steer them away for alcohol and substance use. So those are all kind of important things. But again, as I mentioned, if you're finding someone and they're unresponsive, whether that's in the street or in your home, you want to keep the fact that it could be an opiate overdose. And it's important to have the overdose reversal kits in your house, just like we have first aid kits in our house, just to be prepared.
I mean, it's that serious that we really have to be, it sounds like, rather aggressive about how we're going to try to help our community. Talk about Narcan. I've heard a lot about this, and explain to all of us, what does that mean?
Sure. So Narcan is one of the brand names for naloxone, which is a overdose reversal agent. So it's a medicine that kind of will block someone from overdosing or reverse or overdose if you give it to them. It's available as an injection, but the most common form is Narcan, which is a spray. And so I have here with me my opioid reversal kit,
Wow.
and we have Narcan sprays in it. So I keep it in my car. I have Narcan in my house just in case, because you never know, when you might need it. And I have here the Narcan spray. So it's just a simple spray in your nose and calling 911, and you can save a life.
A simple spray, and you call 911, and that's powerful, Dr. White. Wow, my goodness. So tell us about the possible expansion of the availability of Narcan.
Yeah, we're really excited that now the FDA has approved over-the-counter availability for Narcan. And so, it'll be a while before you can actually find it in your drugstore over the counter, as they're still working out the details. But it's nice that they've started with that approval process to make it available. But right now, most states and counties have availability of Narcan. If you do an online training, you can get it mailed to your house. and websites like Next Bistro. And if you look at your county website, most of them will allow you to get free Narcan delivered to your house, or a lot of states have universal prescriptions where the state has a prescription, you can just go to the pharmacy and pick it up. You don't need to get a prescription from your doctor.
Wow. So, so that's like really wonderful you're talking about. So they're making it easier to obtain it. Thank goodness. So let's talk about the programs and campaigns to educate youth on the dangers of fentanyl and opioid use.
So each, state and the CDC and the National Institutes of Drug Abuse all have different campaigns trying to increase awareness of, the danger of opioids, to do things like prescription drug take-back day, which is later on this month, where you go to your medicine cabinet, get all the medicines that are expired, you're not using, that you're not taking, particularly medicines like opiates and other addictive medicines like benzodiazepines or your anti-anxiety medicines. Take them in to the drug take-back bins. Those are very important ways to get the use out of your house. One of the common ways that adolescents first start using or get exposed is just in their medicine cabinet with leftover meds that maybe someone had for a surgery or for a tooth procedure, and then they decide to take it, and that can be sometimes their first exposure.
Wow. So basically, I mean, that's how we can really start addressing what we have in our home and getting that out as soon as possible. And the drugs.
Sure. And if you have a family member that has to be on opioids, whether it's chronically for chronic pain or whether it's temporary after surgery, ask for the lowest dose, the smallest quantity of it, and then keep it locked up and away from all of your kids, whether it's a 2-year-old or an 18-year-old. You don't want them to have access to meds that weren't prescribed for them. And so you can get a prescription lockbox and get them locked up or somewhere, keep them different than in your typical medicine cabinet where anyone can access them.
So it's a lot more, we have to be, it sounds really aggressive. You lock it up so that way no one can get to it unless they need to take that medicine that
Correct.
it's prescribed for. So now we're going on to how the community can help. Are there ways, you said that we can do that? Are there programs out there and seminars that we can kind of like get involved to help?
Sure. So one, if you're getting your first aid training, they now have a component of this as a part of first aid training. So just being prepared for emergencies with first aid and CPR, Narcan training is mentioned in that. I mentioned before, you can go to your county websites or organizations that have footprints in multiple states like Next Bistro, and kind of put your zip code in. They'll figure out what agency, can give you the education online or send Narcan to your house. There are community events. Most children's hospitals will have a prevention arm, and so going to those events can be helpful as well. And then some schools have this as a part of the curriculum. And so just asking your kid's school, is this a part of the curriculum? And if not, how can we get our kids exposed to this information, is really crucial.
I like what you were really saying. You were giving us tips. You said, get involved with your children. And that, can you give us some suggestions? Because, I mean, sometimes that's a bit daunting. And so what's step one? How do you do this?
I think step one is, we know kids will, model what you do. So you have to model responsible coping behaviors and have positive relationships with alcohol and drugs. And that's really important, to show that if you have a bad day at work, you're not always just going to a glass of wine. Maybe you go for a run, maybe you call a friend, maybe you're listening to music. And so think about kind of our own behavior because they model after that. And kids will see what we do for stress and we'll do other things. I think it's also important, now with all of this distractions and stressors that this generation who's, coming out of a pandemic is dealing with, they need coping skills. And so they need an outlet And I talk about, you want to have all the bases covered. You want to have some emotional, coping skills. You want to have some connection or spirituality. You want to have a physical outlet so that people are exercising or yoga or doing something physical to manage stress. And then some people will need talk therapy, or sometimes that's talking with a pastor, a youth group person, a parent. So all of those things, and just modeling that that's what you need to cope with life. The answer is not necessarily to have a drink of alcohol or to take a pill for everything.
I'm taking notes because it's the exercise, as you said, it's the spirituality, and then how do we model the behavior? My goodness, did I miss something else?
I mean, we also want to talk to our kids, and you want to talk young. Kids start getting exposed to this stuff in middle school, so it's really 9 years old is when we want to start asking kids about alcohol use. And I know that sounds really young, but I've had patients who drank for the first time on their nine-year birthday party. And so it's recommended that when they're going to their pediatrician's offices or their family doctor's offices, that we're asking them about things. They need to have alone time when they're adolescents with the providers, just in case they're uncomfortable having discussions with you present. And then we want to encourage them if they're not using behavior, if they've tried something, I don't want to be punishing, but you want to talk about, strategize. What would you do next time? How can you avoid, a situation that you were in before? And, this is really important.
I really respect what you're saying, Dr. White, because I think that the pandemic has really increased things for our young people, for all people, but most troubling for our young people about what they're going through. And you said no punishing. Speak a little bit about that.
Sure, you want to have an open relationship, and that doesn't mean that there's no consequences, but you don't want to punish them for being honest with you, particularly when you're thinking about going to a party or before you let them have a license. Have a contract with your kid that they can send you, have a safe word. They can send you a text and say, pick me up, no questions asked. And then tomorrow we'll talk about what happened. But you want to be the person that they're calling, not someone else, because we know our kids, we want what's best for them, they're safe, and you want to make sure that if they get into a situation where they're at a party and maybe they've had something to drink or maybe someone else is using drugs, they can call you, you can pick them up, no questions asked, no yelling, we'll talk about it tomorrow. And so if you tell them that in advance, then hopefully they will utilize that. Not always, but hopefully they will.
You're talking about a different level of parenting. I parented, 100 years ago, okay? None of this, I can't imagine speaking to a 9-year-old, but I would be doing, if I had a little one, I would definitely be going through this, because having the safe word, I never thought about that. And knowing that, your child could, they can text you.
Right. I think that's one of the best things that this generation does have is texting. I know that's how sometimes my kids will reach out for things that are a little bit uncomfortable to talk about, is via text message. And then as a parent, you can kind of read it and kind of measure your response, have all the feels, as they say. But by the time you respond back to your child, hopefully it's more of a rational, respectful, and not your first knee-jerk emotional or angry reaction. And so, you want to have communication. You want to, delay use of social media and things until they're older, mature, and then make sure that you're being aware of who their friends are, both online friends or in-person friends and school friends.
So as a parent, it's not just your school friends, but it's online friends too?
Correct. Some of the ways that kids are purchasing drugs is through some of the online platforms and having them ordered or getting delivered via the online platforms. So just being familiar with things. If things don't look right, there's emojis you may not understand, or some things that you're concerned about. Ask kids, ask your fellow parents, ask your providers, just to make sure that everything is okay with your young person.
Oh my goodness. So now it's moved to an online platform. And And it's almost like when you talk about emojis, I mean, that's almost like another language. You know,
Correct.
for me it is. Not for
Yeah, and
you,
it
but for
changes all
me.
the time, so it's hard to keep up with it. But you can do online searches again, talking to parents, talking to people more their age, if they have older siblings, if you have other kind of young adults in your life, to say, hey, I see this on my kid's phone, or this is on their social media. Should I be concerned about? Does it mean something? And just talking to the kids and then making sure that they're aware of safety online and in person. But it was concerning that people are contacting their drug dealers through some of these apps.
I had never thought about that. And it sounds like what you're saying is that it's almost like building, these relationships as parents, that we're talking to each other and sharing, what we're learning, so we can kind of, let's say, be that bit of a net, to catch them.
Right. It takes a village, and so it's as parents, we also want other trusted adults in their lives that hopefully is their healthcare provider, or hopefully it's someone at school in a youth group and a sports group. And again, having people involved with activities keeps them busy, keeps them supervised, and less downtime to get caught up in some of the distractions that youth are facing now.
So I have to say to you, you've given us a lot of good, solid information. And I would have to tell you, you are a physician. How do you keep yourself moving forward? You have you're a renowned doctor, and you're everywhere. How do you keep yourself motivated and model that behavior? What do you do?
So I personally think being an adolescent medicine doctor is the most fun specialty, because I get to deal with youth and young adults all day long, and they give you energy and they give you life, and so it's fun. We're always laughing. They always say something that's unexpected. I learn new things all the time. So that really is helpful, to be in a career and be with a patient population that appreciates you. You appreciate them, and it is fun. Also, my colleagues, adolescent medicine doctors, are some of the most wonderful kind of doctors to hang out with, to be collegial with. And we really care about youth and about making everybody feel safe and welcomed and cared for. So those are some of the things just about the career. And then in general, like again, I try to do the positive coping myself. It's been hard going through the pandemic with as a parent and as a pediatrician, and so taking time out to hang out, to travel with friends, and just to relax with the family is some of the things that I do.
Wow, well, you certainly are doing all right. You glow, and that's why you're smiling. As you're talking about this, you're giving us so much hope. And my last question is, what inspires you?
That's a good question. I am inspired. I think by my field, a field that's dedicated to seeing the strengths in youth and not just their problems. I'm inspired by my colleagues and by my community. It's really all of those things inspire me. And I really want to make sure that all youth get the healthcare they deserve, regardless of whether they're using substances, they have a substance use disorder. We want to make sure that they're getting all the healthcare that they need, and that inspires me to make that a reality for them each day.
Well, and cannot thank you enough for being on the show. And Dr. White, we'll end with this. Where can we get more information about Children's Hospital of Philadelphia?
Sure. You can go to the website www.chop.edu and find out about all of our programs in Philadelphia. We see people from all over the world at the Children's Hospital of Philadelphia.
Okay. Well, thank you, Dr. White, for being on Ingrid's World to discuss your wonderful work in medicine. We are grateful for your discussion, and thank you so much for educating us. My inspirational quote is from Michelle Obama. Do we settle for the world as it is, or do we work for the world as it should be? Thank you so much for watching Ingrid's World. Connect with me on Facebook and at Ingrid's World. Follow the show at Ingrid's World VA in Twitter and Instagram. And remember, you can watch an episode of Ingrid's World because the show is on Ingrid's World YouTube, LLC YouTube channel, and ingridsworld.org. Bye for now, and thanks for watching.